It is Tuesday, September 15th. Kahnawà, Joe Delarone, UJets. Welcome to today's task force update, the COVID-19 task force. We have not too long a show, but I think an important one. There's lots that is going on. We'll have our two regular contributors on the program today, and we'll start with the Commissioner of Public Safety and the head of the Kahnawà COVID-19 task force, Lloyd Phillips. Lloyd?
Thank you, Joe. Good afternoon, everybody. I'll be brief this afternoon. I just wanted to touch base on a few issues that are happening around our community. I'm sure most people have been paying attention to the news and gradually watching the numbers of infections of COVID-19 has been gradually increasing over the past several weeks. And for those of you who may know, Quebec had put together its own process for evaluating the levels of alert that they're recommending for various regions throughout Quebec. Basically, a green level, yellow is increased early warning, orange and then red. That's Quebec's system, and they have recently increased the region that we commonly refer to as the South Shore into the early warning or into the yellow area. This is of Quebec's system. Obviously, we always pay attention to what's happening around our region, around Montreal, throughout Canada, and so on. We do have our own internal planning and our own internal work that we are doing. But we obviously got to be mindful of what's happening, certainly in the areas around us. So we're watching this very closely. And we will be having a task force meeting tomorrow to discuss a number of issues that are very important and crucial to our community. We will be doing a much more full assessment. And a matter of fact, we will be having a Facebook Live tomorrow to provide more extensive updates and information to the community. And with that, part of our assessments includes various elements that we look at very closely that help us determine our levels and help us make decisions. And here to expand upon that more, give you a little more insight on that is Lisa Westaway. So thank you very much. See you tomorrow.
We spoke a little bit last week, in fact, or I had presented some of these elements to you last week, but we feel it's important to remind you of them and to continuously talk about them so that you're fully aware of what we're looking at in order to make decisions about how we move forward. And so I'm just going to go through the indicators that we'll be looking at on a regular basis so that you get familiar with them as we move forward. So one of the elements that we look at is a common element that we see looked at everywhere, and that's number of cases. Generally what we're seeing in the different regions around us and the Quebec government and other provinces as well, they look at number of cases per 100,000 population. So we of course have to focus on that for the regions around us. That helps us make decisions here in Kahnawà. But when we talk about rolling backwards or increasing secure measures regarding the pandemic here in Kahnawà, we also look, of course, at what's happening here in the community. And so because our population is so small, we can't just look at number of cases. We have to also look at other elements. So number of cases is very important. Of course, one case here in the community in an 8,000 person population or slightly more is still a very high number, and that is already a cause for concern. And it means that we have to have extra vigilance and be really knowledgeable about where that case comes from, how the virus was contracted, and all the possible contacts. So the second aspect that we look at is percentage of positive cases compared to those who were tested. So we know that in Montreal, in Montérégie, in the regions around us, they are already surpassing a 2% positivity rate. What this tells us is that there are not enough people being tested. So we look at that as well. Right now, we don't have a positivity rate in Kahnawà because all of the people who were tested are negative. We know that we've had an increase in testing, which is positive. We need to continue to increase our testing and make sure that we're testing all the people that require testing. So anything at 2% of positivity rate per number of people tested is a sign to us that we need to start being more cautious. Well, in fact, that we have to consider lockdown measures or a reverse lockdown procedure compared to the reopening that we had. Another aspect that's very important to look at is our ability to contact trace within a very short period of time. So that means being able to identify our cases, so people being tested, getting results from the lab in a very quick turnaround, so less than 24 hours or 24 hours, 24 to 48 hours, and then being able to contact trace those positive cases, so knowing exactly who is impacted by the positive case, who needs to self-isolate, and then ensuring that we do self-isolate when required. So that ability of our local public health team and of our regional labs working in collaboration, the ability to do that quickly will also determine whether we should move forward with more strict measures and closing down of certain services or businesses in the community. So all of those elements are all considered in our decision-making process. So again, once we have one case in the community, it already indicates to us that we need to move forward with certain measures. It's important for the community to be aware that one case in the community and the analysis of that particular case could have an impact on KMHC visitation. So right now, we are still having outdoor walks with family members. So should we have a positive case in the community, we will look at reversing the phases that we used for the opening. We would go backwards one step at a time. So one case in the community would mean that we would no longer have outdoor walks. We would revert back to visits in the patient's rooms or in our outdoor courtyards. So this is just a little bit of a segue into where we might be going in the future, but it's important that you understand and be prepared that these are the elements we're looking at. So it's not just random decisions that we make, but we're actually focusing on these scientific matters, and we have Dr. Gauthier also involved in the decisions that we make as we move forward. We're also, if we end up at 5 cases, that to us is an indication, so anything from 1 to 5 is an indication to us that we need to start looking at community measures. So hospital, of course, being the first thing that we look at because our most vulnerable population is there. We would also be very, implement these measures at the Elders Lodge and at other areas. And then we would, 1 to 5 cases, we would look at other measures in the community. But again, we'll be giving you more information about that as we move forward. So again, just to go back and go over those 3 points, we're looking at number of cases per population, the percentage of positives per number of people tested, and our ability to contact trace within 24 to 48 hours. So I hope that's helpful. Tomorrow we'll give you more information as we move forward, and so that's it. We'll see you tomorrow.
Thank you very much, Lisa, and thank you, Lloyd, as well. Tomorrow there is a task force meeting, as Lloyd mentioned. There is a meeting every Wednesday for those who aren't aware, and we will do an extra program tomorrow. As we've said all along, we have Tuesday and Thursday programs in the last couple of months, but as needed, we will do more, and one of those will be tomorrow. So that'll wrap it up for today, and we'd like to thank Lloyd and Lisa. We'd like to thank you guys for watching. Remember, stay safe, wash your hands, wear a mask, and social distance, and we'll get through this together. behalf of all of us, Niao Koa Dano, Honigi Wahine.